Greetings, friends and followers. This is Nurses Talking, and I am Dale Barzy. As always, if you like what you see and hear, subscribe, leave us a comment, let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today, I am very, very pleased to welcome Dr. Lendra James of USA. Dr. James, as I just said, is a very prolific nurse. She is a coach, she's an entrepreneur, she's the CEO of DL James Consulting, which the goal of which is to nurture nurses from burnout through breakthrough. She's a speaker, she's an author, she's a podcast host, she's the host of Nurses with Voices, and she's involved with a movement called Nurses Shift Change. So, Dr. James, let's just dive right in. Welcome, welcome.
Thank you. Thank you for having me. I'm excited to start talking and chatting.
My pleasure, my pleasure. But tell me first, why are you a nurse? What brought you here?
It's so I love answering this question. I guess it was, and I'm guessing, right? It was a calling that
Ah,
I didn't know about, right?
uh, uh,
And I say that because, a lot of people have that story where they had nurses in their family or something happened to a
mhm,
family member. And that just really wasn't my story. We weren't really expected to go to college, where I grew up. It was, there was a large percentage of us who wasn't really expected to even graduate high school. And I myself, I actually was someone who was on the honor roll. And even being on the honor roll, you would think they would be looking at, and I even received a presidential scholarship, right?
mhm,
So you would think they would be looking to try to help me go to college and 4-year schools, but that wasn't the case. I actually was
mm,
offered to go to an LPN school, which was being offered in my community for free.
mhm,
And when it got time, maybe about a month before it was time for me to go to school or start the program, it was an LPN program. And
mm.
about a month before, the school was closed. They closed the school down. So everyone who was enrolled that was supposed to start that program was automatically enrolled into the county college program, which was an RN program.
Okay.
And from there, and it was just so from there, like my nursing journey began, and I obtained my associate's degree a few years later, and the rest is history. Went back to school some years later to get my bachelor's degree around the time when everyone was pushing. A lot of hospitals were pushing to go back for your
Yeah.
bachelor's because they wanted to go magnet, and if you
Mhm.
had an associate's degree, you weren't sure if you were still going to have a job, right? So then graduate school, graduate school after that. And then a few years later, my doctorate degree. So here we are.
Was kind of a circuitous route for you.
Yeah, exactly. 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 It wasn't like, and I tell my son now, just go straight, just go straight forward, just go. But you know what? These kids have these days, they have such a different perspective, which
Mhm.
sometimes I actually say, we should have thought about that. These
Yeah.
kids, generation, they don't stay where they don't feel valued, or they don't stay where
And you
where
know
they don't.
what? I am so proud of them for that.
Yes, yes. A friend of mine, she was just like, she was recently, we were talking, and she said, why did I stay at that hospital for 20 years? Because that's what we knew, right? That's how we were taught.
Mhm.
We were programmed. You have this job, you stay here for 20, 25 years, you retire with your pension and benefits. Not knowing there's a whole new world out there. There's a whole new world of entrepreneurship. There's a whole new world where you can make passive income streams, but no one teaches us that. And if you don't know that, and if that's not your story, or if that's not the community or environment you're in, you just think working in the traditional setting is it. This is what I want to
Yeah.
do. I want to get that extra certification. I want to get that extra
Yeah.
degree so that I can climb the ladder. But you're doing all of this to make someone else rich. And how about build that generational wealth for yourself?
Yes,
Right?
yes, yes. And the remuneration from what you spent to gain the education doesn't match.
Doesn't match.
Doesn't
Doesn't match.
match.
I mean, don't get me wrong. Do I believe that education is important? Absolutely. Because
Absolutely.
when we look at our ancestors, they weren't able to get that education, right? They wanted us to go to school because they weren't able to. So we've been pushed to go to school, not only just from society, but from our family members who weren't able to
Yeah.
do it. So when you think about like my grandmother, she had something like a fourth grade education, right? And my great grandmother. my great grandmother, she couldn't even read, right? So my mother would read to her, and
Mm-hmm.
that's how my mother would read to her grandmother. She would read the Bible to her, and
Yeah.
that's how, because she couldn't read it herself. But
Yeah.
again, these are the generational things that we came from, and so for us to get this education, and it's definitely proud. It's definitely proud for it's. So don't get me wrong, but it's just that when you start still just coming back to when you start to think about, well, what's the return, the ROI on this? you
That's
know
it. That's it.
that's
Yes.
that's
The
that part,
education is absolutely important,
right? Yes.
but it shouldn't cost you your whole life because for
Yes.
many people it does. So what we just got off on the money
I
thing.
know, I know.
You
Listen,
know,
I'm sorry. Gotta stay focused.
you become a nurse though. What kind of area, what kind of areas did you gravitate to?
So I worked all across the country. I worked in so many different areas of nursing. I've worked in cardiac, neuro, trauma, uh, travel nursing. I worked my way up to nursing leadership, achieved my doctorate of nursing practice, nurse exec board certification. And then I shifted my purpose, right? And it was around the pandemic. It was during the pandemic, I should say, where I shifted my purpose to start a wellness business. Because and a lot of that came from, listen, when you're in leadership, no one really prepares you if you don't have mentorship. And this is why I am such a huge advocate for mentorship and coaching, because if you don't have mentorship for certain roles, or the proper mentorship, you'll make, how can I say, you won't be prepared to be able to take on the challenges, right?
I
Or the
know.
battles that
Mm-hmm.
you will have to endure and ultimately overcome. But you have to be prepared for it. And it's a mindset that you have to really prepare yourself for. And it's that growth mindset that's
Mm-hmm.
really, really, truly important to have.
Yeah.
So working in leadership, it really, really prepared me for entrepreneurship. So
Yeah.
during the pandemic, I shifted my purpose to start a wellness business. And that was the entry into me just creating, Dale James Consulting, creating Premier Infusions and Wellness, right? Being able to coach, consult, and mentor other nurses. And I wrote a book. I wrote a book called Confessions of a Nurse Executive, and the
Mm-hmm.
subtitle is The Conscious and Unconscious Bias in Healthcare.
Mm-hmm.
And from that book launch, we got into discussion. When people start hearing, when you say Confessions of a Nurse Executive, like what is that about? And when you say things like the conscious and unconscious bias in healthcare, because those things are real,
They are real.
and they really occur, and it's systemic, and
Yeah.
it truly, and it wasn't until I got into leadership is when I really started paying attention to how systemic the bias was, whether it be conscious or unconscious.
Right.
And because of that discussion, it actually, and people were like, wanting to know more. That actually was the foundation or the catalyst of an event that I host called the Health and Wealth Expo.
Hmm.
And because that the Health and Wealth Expo, what we do is it's actually to address the bias, right? The systemic bias, the lack of leadership support, the lack of mentorship. So that's
Mm-hmm.
what we do with the Health and Wealth Expo. We address these things through blending health, wellness, and wealth through entrepreneurship. So we're able to really show nurses and healthcare professionals how to not only, like how we just talked about, working in, you go to school, you get that
Yes.
degree so that you can climb the ladder, check those boxes. But there's a whole other world out there where, as I mentioned before, you can become an entrepreneur. You can really take your expertise and monetize it, right? Like you
Anything
can
with
really.
it.
Yes, and I can remember being a nurse, and well, I'm still a nurse, but you know what I mean? I can remember early on in my nursing
Mm-hmm.
career when people, you will be told like, oh, there's so many different, areas that you could work in, but no one really teaches you or shares you could be an entrepreneur. Or
Yeah.
you can really take the knowledge, because we've been trained, right? We just talked about, you have all the degrees, you have all of the education, you have the hands-on training, you
You
have the
haven't.
certification. certifications, you can now take those same skills because your skills are always needed. You can consult, you can coach, you could do wellness, you could do health coaching, you could do legal nursing. There's so many things that you can do, but no one really teaches us that.
Right. And you just said that people say, oh, there's so many areas where you can work. But when they said that, they meant within the institutional setting.
Yes, yes, yes. And that's exactly what they meant. To your point,
Yeah.
they were talking about going to the cath lab, going to the ER, but they weren't talking about, because, in some areas, and I was speaking with a young lady from Australia, and, entrepreneurship isn't something that's really, it's kind of somewhat frowned upon because
Mm-hmm.
it's nothing that is encouraged. But again, we were there too. So when we started opening IV hydration, like, if you think back of maybe some few years ago, there weren't nurse entrepreneurs. It's like, what? Even now, when you think about it, there's still it's not a huge percentage of nurses who are becoming entrepreneurs. It is growing because we
Yeah.
are realizing and taking our power back, because that retention in the hospital is not there. And why is that? And this is something that I do with my business, my wellness business, help hospitals with their retention, right? So that they can understand, why are your people leaving? Why are we leaving? We're leaving because we feel underappreciated, undervalued. The burnout is real, right? So
Yeah.
when we talk about nurturing nurses from burnout to breakthrough, I empower high achieving nurses to break through from burnout and achieve financial independence. And I do that through courses, mentorship, and events. And events like the Health and Wealth Expo, because you can create courses, right? You can mentor other nurses. What are you good at? What is something that you're good at that no one else is? You can turn that into a mentorship program, and now you have a business. So I
Yeah.
think we think about it as like, entrepreneur, have a business, like, but think about everything that and all of what you share and what you do already do,
And what you do. Yeah. Yeah.
which you
And
probably already do.
yes, and we kind of think that nobody will buy that, but they will because
They
it's
will.
valuable.
Because it's valuable. And to put it into a course, you'll be surprised. Take what
Mhm.
you know and put it into a course, you'll be surprised. And kind of going back to what I was saying, there's about maybe 75% of the healthcare field who they're comfortable where they work, how they're working, which is great, but do know there is about 25%. And I'm just saying numbers, right?
Yeah.
But it's a growing number that they are interested in taking their expertise and being, because they're tired of the burnout. They're tired of the exhaustion. They're tired of the bullying, the workplace violence. I mean,
Yeah.
look at everything that's going on with the administration right now, the
Mm-hmm.
dismantling of
Mm-hmm.
health and human services.
Mm-hmm. Mm-hmm.
These things affect healthcare
Yeah.
tremendously. They
Yeah.
really, really do. So why not position yourself? So, instead of the fear, right? Instead of walking around with fear, how about we need to have a growth mindset? What can I
Indeed.
do to grow
Indeed.
myself,
Indeed.
holistically? That's, achieve that financial independence. Instead of staying stuck, right? How do I empower myself with confidence, with clarity? How do I do that? You have to take action, and you have to take action. And it starts by you choosing you and betting on yourself.
Exactly, exactly. And we're realizing that we have not just the expertise and the experience, the knowledge. A lot of us are gaining the confidence to do that.
Yes.
And I'm
Yes.
glad to see it happening. I'm happy
Absolutely.
to see it happening.
Absolutely. Oh, I love it. I love it. I love to see nurses taking their power back. And it
Yes.
kind of goes with so everything that we're doing with the nurse shift change movement, that's really about nurses taking their power back, because we see humanities being affected, right? So anytime we're weaponizing things like diversity, equity, and inclusion, you're weaponizing that. You're making it as if DEI is a bad thing. Why is it a bad thing? And you're not and you're reversing, right? Which is what people do, right? You're reversing the narrative, and you're saying, oh, you haven't earned this position on your merit. Well, let's talk about statistics for a second. How about Black women being the highest educated right now, right? And why is that? We just
Mhm.
talked about that. We just talked about how we've been
Mhm.
made to go back to school. We've gone, we've been encouraged, I should say, and
And
empowered to go back to school because of our ancestors. Our ancestors weren't able to
Mhm.
do these things.
Yeah.
Our ancestors, there was something called a civil rights movement. Do we remember this?
Mhm.
So,
Mhm.
because of all of these things, doors have been opened for us because an underrepresented population did not have access to education, did not have access to certain areas or certain tables, I'll just say. And this is why we have that diversity. This is why we have to give access, not just to the handicapped, to the
I was just
disabled.
about to say it applies to so many areas
So
of the
many.
population.
Exactly. And now you're weaponizing it for what? To say that, oh, well, you're getting things that are not on your merit. Well, we're coming to the table now with so many degrees and certifications that a lot of people who don't have as many degrees and certifications as we, they still have positions of that we don't have. So how are we getting things on our merit, right? But what we can do, and this is where the Health and Wealth Expo comes in. What we can do is take those same skills and expertise that we just talked about, and guess what? We no
Make it
longer have to
ourselves.
rely, make it ourselves, take our expertise, turn that into consulting, turn that into coaching. So we no longer have to rely on that W-2, right? We no longer have to rely on an administration that is trying to disempower us and dismantle us.
Mhm.
I had a gentleman that I was speaking to yesterday, within a couple of days, last few days, and he mentioned that he can't support the event because he said, well, if it has anything to do with DEI, because we have a DEI panel that work. He
Mhm.
said, well, if anything to do with DEI, we can't really support it. You know what? That's fine.
It's okay.
Because you know what? It doesn't affect me. So okay. Thanks anyway. Maybe we can work together on something else. But and I said to him, I said, you know what? If you supporting the community depends on funding from an administration, then we'd rather not partner with you.
Partner
And
with
I'm
you.
just being honest with you. But I
Yeah.
do recognize and understand that not every
Yeah.
organization has that option. And I recognize that and I support it and I respect it. But this is where the beauty of being your own entrepreneur, right? And having your own business come into play, because you get to choose who you hire, you get to choose who you work with, you get to choose who you partner with, and you
Yeah.
get to choose who donates and supports your cause. So
Yep.
that's how you take your power back. And I know
Yep.
I went off a little bit in talking about the expo, and I want to kind of bring it right back to the nurse shifting change, but
Mm.
this is how we shift change,
Change.
right? How we shift change is by coming together, by starting a movement, by letting you know that whatever it would the social injustice that is taking place right now, because this is what we're standing for. We're standing for
Mhm.
humanities, ethics, social justice, and the sciences. You can make, and I'll give you an example. And some people like to say like, oh, it's not about the money. Yes, it is.
It
What's your
is.
bottom line?
You have to
What's your bottom?
eat.
You gotta eat, exactly. You gotta eat, and you gotta pay your bill. You gotta pay your bills. You gotta live somewhere. So stop. Right? You did not just. Yes, we went into nursing because we want to help people. Yes, we're passionate, we're compassionate. I get that part.
Like
I get
everyone
that part.
else. You gotta eat.
And that's it. But you have to be able to put food on your table. And why
Mhm.
not do that and not go through the moral distress? Why
Yeah.
not do that and not go through the bias, the bullying, and be worried about whether or not you're going to have a job? Right? Who knew that healthcare would be coming down to being, not having a job? Look at the hospitals that are laying off.
I know.
I
Mhm.
think it was Mass General that had like a 250. And I talked about this in my podcast. They had something like a 250 million or a huge deficit that led them to needing to lay people off. This is Health and Human Services,
This
right?
is,
This is
yeah,
this is
right.
hospitals, right? This
This
is
is
big
hospital.
business. And hospitals are a business. So we're working for businesses, and we're letting or assisting someone else to, CEOs, their pockets are padded, right?
Mhm.
Why
Yep.
not why not be your own CEO?
You be your own
Something
CEO.
I aspire to be working, in healthcare. I aspire to be a CNO. And again, and there's nothing wrong with having those type of goals. But by
No,
the time I got there, I no longer aspired
you
to
didn't
do
want
that.
it. Hmm.
I no longer, and now I'm my own CNO, right?
Yes,
So it's
yes,
amazing how God works, right?
yes.
I'm my own CEO, I'm my own CNO. I have my own team, and I know what I want. I know what's going to work for my community. I know what's not going to work for my community. And when you think about wellness, right? I'm able to help my community my way, advocating for weight loss, advocating for, lowering blood pressures and what they need to do
Hmm.
and how they
Hmm.
can do that holistically, right? Like not
Holistically.
without medication. Listen, you can lose weight and guess what? Now you've lowered your risk for diabetes. Now you've lowered your risk for
For high
hypertension
blood pressure, if you
just
just
by
the varicose
losing
veins and all
weight.
of that.
Yes, just by losing weight. So this is why I love what I do with my business. And I love showing other nurses and healthcare professionals how to do that,
How to
of
do
how
it.
to do the same thing. And maybe your
Yeah.
thing isn't IV hydration. Maybe your thing isn't wellness. Maybe your thing is starting a mental health practice as a nurse practitioner. Maybe you're a great writer, right? Maybe, maybe you do like IV hydration, right? There's so many other things that you can
That you
do,
can do.
and that's what I love. I love being able to show other people how to do that.
And you mentioned just a while ago about being you aspire to be the CNO. Yes. And if we can get people to understand very, very early that they are the CEOs of their own lives, if
Yes.
you understand
Yes.
that early, then
Yes.
you will understand it will not be such a leap, such a huge transition for you to take
Yes.
charge, whether you work
Mhm.
in the institution or not, to take charge of how your life functions.
Yes. Yes. Yeah. I love that you say that because think about it. We would tell our nurses that as preceptors, right? Or as we're precepting them, we would tell them that. We would say, you're the CEO of your patients, right? When
Hmm.
they have
Hmm.
their 1 to 4 assignment, 1 to 6 assignment, whatever it is, you're the CEO of your patient. Well, guess what? You're also the CEO of your life and your decisions. And you're also
Yep.
personally and professionally, you're the CEO. So
Yes.
you have two choices. You can stay in environments that are going to burn you out, stress you out, right? You can stay in those environments, or you can choose you. Which one are you going to do? And I have to tell you, me choosing me was the best thing I could have done. That was the best decision that I could have made. And it's not that, listen, I love being a nurse. Nursing has changed, healthcare has
Has
changed.
changed. Yes, it
you
has.
know, People are sicker, demands are more. There's a huge push for profit, and these things. This is unfortunately it has become, and I'm not the saying has become profit over patients, right? I'm sure you've heard that, right?
Yes,
And
yes.
there's been a huge push, and I think COVID, the pandemic, really just um, it unveiled, right, what
Yeah.
was, and I know at least it did for me. It really opened my eyes because listen, let me tell you, my thought process was way different. I was that, nurse leader that was,
Yeah.
we gotta do this, we gotta, you do all the things like, yeah,
Yeah.
go team, we're number one, and patient experience, we're decreasing falls, we gotta get this for quality. We're doing all of this push because and I think that's what makes nurses and healthcare professionals really good, especially nurse leaders, really good business owners and entrepreneurs, especially coming from leadership, because I was result driven, right? I was very,
Yeah.
very result driven, and I knew my team could do it. Like I knew, like, oh yeah, we can do this. And I had to really, and as I really started to reflect as things were going on and taking place in healthcare, and I was starting to really raise my eyebrow at certain things that I was seeing, really started to have to start asking myself, like, wait a minute, I don't think I'm
This
aligning
is not
with
aligning. Yeah. Hmm.
the mission and the vision. Like, this isn't what I signed up for, right? It wasn't that I couldn't do it, it wasn't I could no longer do it. I no longer wanted to do it. You know what I mean? I
I
just,
get.
and this was me choosing me because we do all the things
Yeah.
as you working in leadership administration, you hire, you unfortunately have to,
Let
terminates.
go.
You know, you hire, you build programs. I built units. I've created policies. You do all
Mhm.
the things,
Yeah.
right? You do all of the things, and then when you're in a position, when you're put in certain positions to be the face of things that you don't believe in,
Yeah.
and then on couple with the fact when you're dealing with a an environment that definitely makes you feel that when you're dealing with bias, let's just say that when
Mhm.
you're dealing, with bias and like, wait a minute, hold on here, where's my value? Like, wait a minute, where's my appreciation? Like, wait a minute, there's way more than I need to be doing than standing here. It's
Yeah.
way more I could be doing than standing here watching someone give bedside report. Right? There's
Mhm.
way more I could be doing than asking someone, did you do hourly rounding? And again, it's not that these things aren't important, but when I started thinking about my vision, when I started thinking and choosing me, it was more than about bedside report. It was more than, again, not that these things aren't important. They're important for the organization, and I get that. But what I have to start thinking, what's important for me and my family? What's
Mhm.
going to work
Mhm.
for me?
Yeah.
What's going
Yeah.
to give me peace of mind, and what's going to help me achieve when we come down to it, and you've worked so hard to make and help the organization to reach certain levels, and then when you're told, um, well, this year's budget can't allow for this bonus,
Yeah.
and we depend, sometimes we want this. What do you mean? No bonus. Listen, now I make my own bonuses, right?
You make your own bonuses.
Now I make
So
my own bonuses. So
I have a question for you. As I looked at your website, one of the things that jumped out at me at your website, you had your messages for nurses, your messages for executives. On the first thing on your messages for nurses was prioritize self-care.
yep.
So
Mm-hmm.
I want to know what you do to care for you.
Oh, listen. So for me, I have made a conscious effort to not, because I've been there, right? I've been there,
Yep.
making sure that everyone else is okay, making sure that
Mm-hmm.
everyone else is taken care of, whether if it was my team, whether it was my family. And this is how you burn out, right? And this is why burnout and burnout prevention is so, so important for me. Number one, I think people don't realize when we talk about self-care, one of the things you have to do is set boundaries,
Yep.
right? No is a complete
Big one.
sentence. And I've said this before. So I've learned how to say no. And learning how to say no, that's definitely self-care. I've learned how to
Yeah.
say no. I've learned how not to take on
Without
projects
explanation. Just no.
without no period, right? Um, I've learned how to not take on projects that are going to, that I have, if it doesn't sit right in my spirit, if I have to do too much moving around, too many moving parts to it, it's probably something I don't want to do, right? When we talk about, so for me, travel used to be a huge piece of self-care, but now for me, self-care could just mean, doing my journal in the morning. So one thing, self-care for me is having a routine. Every morning I journal, I read the Bible. I have my time with my God, right?
Mm-hmm.
I have like, this is self-care for me. It really
Yeah.
resets my day. And I find if I don't do it, my day is off. That's self-care. Taking my time every morning, journaling has been huge for me. Writing my book was huge. I'm writing another book. So we think self-care has to be like, it's more than just going to the massage, getting a massage, right? Not that that doesn't help, right?
That's
Like,
cool.
not the same, like that is definitely, but self-care is so much more than that, right? Like
Yeah.
what it is, and we should have a routine with our self-care. Getting a massage should just be part of it, right? That should
Yeah.
just be part of, maybe you do that once a month or once a week, however you can
Whatever.
afford it or whatever you could
Mm-hmm.
do. That should just be a part of it. Knowing when to step away. Another thing, my self-care is my schedule, my work weeks.
Mm-hmm.
My work weeks are, I take 1 or 2 days to work on the business, and then I take 2 days out the week to work in the business, right? But that's how I have self-care. That's how I prioritize me. I work weekends. I mean, excuse me, I don't work weekends. I may work a weekend is what I wanted to say. I may work a Saturday if depending on the client, what the client need is. But if I choose not to, I don't. But I have set my business up so that I can work that way.
Yeah.
And it works. So so prioritizing yourself and self-care can have several different meanings for several, for different
Yeah.
people. But for me, again, but I do want to stress it goes beyond a spa day, right? It goes beyond getting your nails done. These are all just pieces of it, pieces of
Yes.
it.
Yes.
But having that routine is how you prioritize yourself, setting boundaries, exercising, right? Knowing, that's prioritizing the food you eat. Right.
Yeah.
What are you putting into your system? What are you feeding your soul? What do you
Yes.
know? The,
Yes.
this is self-care. But to me, the biggest one is setting boundaries. That's the
And
biggest.
and that's why I ask that question of every single nurse, because for me, you have to know who you are in order to know
Mhm.
how to care for you. And
Yes.
so the other fluff things, they're good, but you need to know how to care for you.
Absolutely, absolutely. I know, it's something that I mentor with NASDAQ Entrepreneur Center, and
Mm.
one of the questions that I ask my mentees, what do you do for, like the first question, what do you do for self care, right? Like, what do you do for self care? Like, okay,
Mhm.
what did you do within these lives? What did you do for self care? Because these women are starting businesses, and let me be very, very clear. Something that we talk about starting a business. We're talking about being taking your skills and monetizing them. Having mentorship is crucial to doing that because we're
Critical.
coming from an environment where we weren't taught how to start a business. We weren't taught finances, the finance piece of having a business. So, but that goes with any industry. So some of these women that I mentor with NASDAQ, they're not necessarily healthcare professionals and nurses. They have other businesses, but the mentorship piece and the self-care piece is huge. Like it comes with all of it. You can burn yourself out in
Yes.
your business if you're not taking time for self-care. And that's the point that I
Yes.
want to make. So you don't want to go from burnout to burnout, right? The idea is to go from burnout to breakthrough. And if your breakthrough is starting a business and achieving financial independence, I appreciate you asking that question. What do you do for self-care? And you have to find what your self-care routine is so that you don't go from burnout to burnout. We want you to go from burnout to breakthrough.
Awesome. 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 This time has gone so quickly. We have to do this again.
Absolutely, absolutely,
But thank you
absolutely.
so, 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 so much for having this conversation with me. It's
No
been
problem.
truly, I've enjoyed every minute of it.
I'm so glad. Same here. Same. I listen anytime. It's been such a pleasure. Thank you for the platform. Thank you for the opportunity. I appreciate it.
My pleasure, my pleasure.